Knee injuries are not unusual among people who are extremely active, especially those involved in sports. Now, these injuries can be the result of a one-time traumatic event, or they can be due to repetitive use of the knee. Now, injuries range in severity from minor strains to complete tears. Structures within the knee that are most commonly injured include your ligaments, the tendons, and cartilage. Now, a fairly common example of a knee injury is damage to the anterior cruciate ligament, or the ACL. Now, the ACL is usually injured by a sudden twisting motion, which can often occur as the result of athletic activities or in some jobs that require a great deal of twisting. Now, other knee ligaments that can suffer injury are the posterior cruciate ligament, called the PCL, and the medial and lateral collateral ligaments. Now, the PCL can be injured by a direct blow to the knee, for example, a front-on tackle in football. Now, the medial and lateral collateral ligaments stabilize the knee. They limit that side-to-side motion. Now, the medial collateral ligament is often injured due to a blow to the outside of the knee, while the lateral collateral ligament is frequently injured by a trauma to the inside of the knee. Now, another common knee injury involves the meniscus. Now, the meniscus is a C-shaped piece of cartilage. It acts like a pad between the femur, or the thigh bone, and the tibia, or the shin bone. The meniscus can be injured if the knee is twisted while bearing weight, and a partial or even a total tear can occur. Now, a medial collateral ligament injury may also result in a tear in the medial meniscus. Well, if the tear is small, that meniscus may heal without surgery. However, if that tear is large, a fragment of the meniscus may prevent normal movement of the knee, and surgery may be required. Now, an example of a repetitive injury to the knee is a condition called chondromalacia, or runner's knee. Now, chondromalacia is due to an irritation of the undersurface of the kneecap. Now, the undersurface of the kneecap, or the patella, is covered with a layer of cartilage. Now, this cartilage normally glides smoothly across the knee when the joint is bent. However, in some cases, that kneecap tends to rub against one side of the knee joint, and the cartilage surface becomes irritated, resulting in knee pain. Now, tendons attach the muscles to the bone. Overusing a tendon, that happens frequently in some sports, can result in the stretching and the inflammation of the tendon. Now, one example of this type of tendonitis is called jumper's knee. Now, in sports that require jumping, such as basketball, the tendon can become inflamed. Now, more severe injuries to the tendon can result in a rupture or even a tear.